You know her as Dr. Jackie. She's the one that, unlike pretty much the rest of the cast, she doesn't argue with anyone. She doesn't fight. She doesn't, snatch her wig off. She's a stand-up lady. Okay? She's seen as the reasonable one. Married to medicine. Doctor says Black women cry wolf. Could Dr. Jackie have really said this? Apparently. Her Page 6 reality star, Jackie Walters, Dr. Walters, has come under fire after a resurfaced clip of her saying Black women cry wolf about their pregnancy pains. Dr. Jackie is now saying her statement was misconstrued. However, she didn't apologize when recently addressing the clip. For anyone unfamiliar, Dr. Jackie is one of the longest running stars of that show. She's been with the show all 10 seasons. So really, it makes her one of the longest running stars in Bravo history. Been part of that main cast since 2013. Here's the clip.
Sometimes as African American women, we're a bit more dramatic in that you go to the doctor and you complain and you complain and you complain, and you're not taken serious because you cried wolf the entire pregnancy.
That ain't me, boo. I don't know what you're talking about, but go ahead.
I didn't say you. I just said as African American women, we want to also make sure you're being serious with your doctor and not playing the game so I can take you off work. Because then we see you 25 times in the pregnancy. It's hard to believe that there's a true problem when there's a true problem.
I like Dr. Jackie, and I think she's a talented doctor, but elaborating right there on the initial headline of crying wolf is even worse. It's even worse when you hear it. I worked the last day of my pregnancy like a lot of women with complications. Perhaps not smart, but I don't know why you're casting this aspersion on us. 65-year-old married to medicine star wrote on her Instagram stories Thursday, quote, recently a clip from a nearly 2-hour video was taken out of context to make it appear that I somehow take lightly what I have advocated for concerning the devastating problem facing the Black maternal health crisis. It has been my life's work to highlight and attempt to rectify the issues that devastatingly impact Black maternal mothers versus our counterparts. Two things can be true at once. She has worked in that capacity. She's worked in that capacity. And that was not taken out of context. You said what you said, and perhaps you regret it now, but it's damaging. It's damaging. She knows that. Dr. Jackie, who has been an OB-GYN to many celebs, including Real Housewife of Atlanta star Candy Burris, singer Tamar Braxton, wrote that she educates her parents to advocate for their own health. As a physician, I educate my patients every day to be their own best health advocate. As we continue to face medical mistreatment and gaslighting, my intention with the broader conversation was to ensure patients enter their pregnancies armed with information and tools to effectively communicate their needs with their doctors to ensure positive outcome. That's if their doctors are going to believe them when they say something's going on here and I can't go to work. I need to figure this out with you. They got to be believed. She concluded, the reason I became an OB-GYN is because growing up, I saw such a lack of diversity amongst medical professionals and was determined to be part of the change. Yesterday, today, and tomorrow, I will continue to fight for the lives of Black mothers and babies. Dr. Jackie was slammed this week after the clip of a YouTube live video from April 2020 with her Married to Medicine castmate, Dr. Heavenly, resurfaced online and went viral. In the video, the Queen V author said that sometimes African-American women can be a bit more dramatic when they go to the doctor and complain. The entire pregnancy, Page 6, with the reporting. Fans were shocked by Dr. Jackie's remarks, especially as it is statistically shown that Black women do face racial disparities during childbirth. According to the CDC, Black women are 3 times more likely to die from a pregnancy-related cause than white women. Multiple factors contribute to these disparities, such as variation in quality health care, underlying chronic conditions, structural racism, implicit bias. The health agency said it is a real thing, Rayyvana, and I'm disappointed. She's a good lady who does work on behalf of particularly Black women and healthcare, but this is not something to stand on, and I hate the taken out of context. I don't like the statement.
Mm-hmm. Absolutely. And, I don't want to discredit any of the work she's done. She's a great doctor. She has advocated for these issues, which I think is why so many people are taking offense to this statement because they know that, she's better than this and that she's fighting for these issues. And they know that, women are less likely than men to be believed when we talk about our pain, but Black women particularly, so much so that medical schools are having to redo their training to better inform doctors on how to try to get this bias out of medicine. So I think that it's going to be important that she puts out a better statement, just disavows what she had said, owns up to it in a more meaningful way, doesn't try to cast it aside as being out of context, and just has a meaningful apology, and then
Yeah.
she can fall back on the real work that she's done, and people I think will forgive her.
Yeah. Don't keep this narrative running. Disassociate. She's a brilliant doctor. She really is. And perhaps she was trying to have an inside conversation. But it's a dangerous one. It's not true. I don't believe largely. Black women, no matter their economic status, fall into that category. Disparity when it comes to prenatal care, maternal health. That's just a fact. And so any green lighting of this stereotyping of Black women is so dangerous. And I think she knows that. I hope that Dr. Jackie, well, again, done great work and been an example for many, will let it marinate and quickly come with something more effective in the statement here.